in the program, and also Catherine Weatherup will be joining us later. She's currently also working on the COVID response of the Welsh government, so she's very busy with that, as you can all imagine. She will be joining us later, and we'll be asking some answering some questions. So that's the logo of Public Health Wales. Also the logo of JAHE. JAHE stands for Joint Action Health Equity Europe, which is a program of the European Union, part of the health program. And the general objective of JAHE is to improve health and well-being for all Europeans. So with greater equity across all groups, so shortening the gap between those groups. And through the program, countries can learn together from each other's approach and also develop their approaches. All to shorten the gap in health between the different groups. Well, the SDGs, they are a very useful framework for doing this because, we will elaborate on that later. I'm not going to give away that just yet. Before we go to the presentation, first some housekeeping rules. Please keep your microphones muted. I see that everybody is already doing that, so that's fine. When you want to ask a question, that's of course possible. Use the chat function. We will look for a good moment in the presentation to answer the questions. Well, the webinar is recorded, so if you do not want to be in the recording, please turn off your camera, and then people will not be able to see you. And the slides will be shared afterwards, also including a link to the recording of this webinar, so you can look back at it. What are we going to do today? We have a very large program in short time, 1.5 hours. In the next 1.5 hours, where I will give you a short introduction to the Sustainable Development Goals, the SDGs. Sarah will be presenting to you how Wales uses the SDGs, and we will practice together with one of the tools they have developed. And for this activity, we have sent you 2 documents up front. You don't need them right now, but please have them ready when you are placed into the breakout rooms. This is one of the documents describes the activity we're going to do, so it's a nice backup if you cannot really remember what was the task. And the other one is kind of a secret. We'll come to that later. And after the activity, we come back in this room and we will discuss what we learned from this and what we can learn from each other. Well, around 12:30 we will finish, just in time for lunch, and I'm really trying to manage to make it 12:30. So, before we start, does anybody has a question you want to ask right now? Please raise your hand if you do, then we will see. I'm not seeing any hands, so I think we are going to start with the SDG part. Need to go back one more slide. Yes, this one. Before we go to the SDGs, I will first give you an outline where the SDGs fit in with or connect to the GezondIn program. Well, to most of you, it will not be a surprise that GezondIn is a big advocate for health in all policies, or health equity in all policies. We are trying to help municipalities to come to a more integral approach for tackling health inequalities. And it's part of our strategy to, the strategy based on a lot of international literature, to make it an integral approach. And the strategy, if you want to read more about this, you can see it in the publication you see on the right. In the slides I will send afterwards, I will make it a link so you can click on it. Well, we find this integral approach very important because when you look at health inequalities, they are influenced by many factors, and not all factors are directly influenceable by health policy. And a nice picture to illustrate this is the picture from the WHO report, which you see in the bottom. This comes from the European Health Equity Status Report, published in 2019. And as you can see, only 10% of health inequalities can be explained by healthcare. So there's a lot of other factors influencing health inequalities. They're in all aspects of life. They can be on work, they can be on housing, they can be on all the other aspects as described in the graphs. So it's very important to look at health from different fields and cooperate with colleagues on shortening the gap between groups. So cooperation with colleagues and professionals is a quite essential part of our approach. And the SDGs are a transcendent goal, are there transcendent goals that can be used to connect these fields of policy. So when we look at, there's one back, two back. So when we look at the Sustainable Development Goals, there are a nice framework of 17 goals, which were agreed upon in 2015 by the United Nations. And they are a blueprint for a better and more sustainable future. And it's the aim of the United Nations to achieve these goals by 2030. So we have 10 more years left. I think we need to keep up the hard work because there are quite ambitious goals and not a lot of time to do. Well, some of these goals are more applicable to health inequalities in the Netherlands than others. For example, we are not really having a difficulty with providing people with clean water and sanitation, which is goal number 6. But this is a problem in sub-Saharan Africa, for example. So the goals are very broad and wide, and some of them are more applicable to specific regions and others to other regions. But if you do look at some other goals, they are more applicable for health inequalities in the Netherlands. For example, goal number 10, reducing inequalities, and if you combine this with goal number 4, equality of education, you come close to what we call in Dutch onderwijsachterstandenbeleid. The policy aimed at reducing the gap in education. And municipalities, of course, also have a role in reducing the effects of poverty, which is goal number 1, which is also related to health. Well, as you can see, most of the goals are linked, and making these goals a framework to make choices about policy. So it's a very integral way of looking at what you are doing as an organization. On the right, there are several links to give you more information later on. I will also include those in the slide pack. But for now, I think they are going too far. I want to do a quick check with you. It's going 2 at a time. Who is currently using the SDGs in their municipality or organization, and how are you using them? Does anybody want to give an example of how their organization is working with the SDGs or not, of course? I'm not seeing any hands, but Annelies, I see you raise your hand.
Yeah, hi Sarah, nice to see you too. I'm a colleague of yours, but I put it in a list of little hooks, things that you can maybe use to advance your health approach or your health inequalities approach. But I find that from a health perspective, not many local governments are using it. But from a sustainability perspective, your government or your local government might use it, but maybe you don't know it. So it might be interesting to check that with your colleagues. Maybe you don't know it and you're missing out on something. But I think it's early days from a health perspective, but I don't know if other people recognize that.
I think that's a great remark, and that's also my what I see when I talk to municipalities. And previously, I worked at a municipality myself, and I saw the same thing. From health perspective, we were not working with the SDGs, but from sustainability, for example, they were. I think it's a good remark, and well, even more reason to listen to our guests from Wales, because they did incorporate it also in health, and I think quite successfully. Sarah, I would like to give you the floor, if you like.
Thank you, Tom. Thank you for that introduction to the SDGs and to the work that you're doing and that we're doing. I have to say, goedemorgen. Is that right? Goedemorgen. Bore da from Wales. Good morning. That is the absolute limit of my Dutch. So I'm very grateful to you all taking part in this webinar today in English for our benefit. Thank you very much. As Tom mentioned, my name is Sara Peacock. I am the Senior Project Manager for the JAHE, as we say it, you say JAHE, project programme with the EU, and I'm based at Public Health Wales, which is part of the health system here in Wales. Kathy, who will be with us later on, is policy lead for this, and she's a great person. If you have any questions about what I'm about to show you, I'm hoping she will be able to answer them later on, because she actually was instrumental in setting up the Wellbeing of Future Generations Act, which we're going to talk about in a minute. So do I have control, or am I relying on Petra now? If we could have the next slide. Oh, I can control. Okay, brilliant. Except it's not working. I'm sorry, it doesn't seem to be working, Petra. I can't seem to move the slides across, I'm sorry.
Perhaps, Petra, you can forward the slides, and Sarah, you just say next slide or previous slide, and then...
That's fine, I can remember, that's fine. If you just go to the next slide, please. Perhaps if I get them on my, I do have them here, and perhaps I can then start talking while we're waiting for the slides to catch up. Brilliant. One back, please. Oh no, that's right. Sorry, that is right. Sorry, Petra, that was right. So as the UN was developing the Sustainable Development Goals, which are an international framework, we in Wales were having our own conversation. The Sustainable Development Goals are about the world we want. So we in Wales had a national conversation about the Wales we want. And this reached out into all our communities in Wales, asking people what their hopes were for the future. And from that, we developed a shared vision that you can see in front of you here on this circular image. And we identified 7 wellbeing goals for the country. Now, these are our version of the Sustainable Development Goals. They're not better or worse. This is just the way that Wales want to shape them. And we have developed legislation to enact these. So we have a prosperous Wales, which is obviously economic growth that's mentioned in the Sustainable Development Goals, and a healthier Wales, which is number 3, good health in the UN goals. So they all map across. And so legislation was developed to put these into law. And part of this preparation was working out how we would do that, how we would put it into the legislation, what steps we would take to enact it. So if we can go on to the next slide. This is what came out of that, the Wellbeing of Future Generations Wales Act 2015. And we have to put Wales into the title. So we makes it clear that this doesn't apply to the rest of the UK. This is just for Wales. So the Act puts obligations onto all of the public bodies in Wales to work in a sustainable way towards these 7 goals. And I will come back to the sustainable way in a minute, because this is the bit that's going to be relevant for people trying to work with the Sustainable Development Goals. The Act also established a Future Generations Commissioner. So our Commissioner, Sophie Howe, has an office and they oversee the implementation. They provide support to the public bodies to help them enact these. And it also requires us as public bodies to provide evidence of how we're working towards these goals and how we're using the Sustainable Development Principle, which is called the 5 ways of working. And we'll come on to that in a minute as well. So if we want to go on to the next slide. So these are the 5 ways of working. These are laid out in the Act as the way that we need to be working towards these goals that we have. And that we call this also the Sustainable Development Principle. And this is the part of the Act that I think is applicable outside the Welsh context. Whereas you don't have the legislation of the Commissioner, the goals that are in law, this way of working, these 5 ways of working, really can help anybody who's concentrating on working in a sustainable way. So the 5 principles are these, that we think in a long-term way, that when we make decisions, we don't think about an immediate quick fix. We're looking for something that's going to be sustainable, that's going to work into the future. That we look to prevent problems before they arise. Again, we're not working in a reactive way, we're working in a proactive way. And those of you that work with impact assessments, whether that's health impact assessments or equity impact assessments, these are a really good tool for this preventative approach. We work at integrating this sustainable development model into all aspects of the operation. So it's not a silo. It doesn't just happen in one department. This is something that needs to be happening across the organisation as a whole. And to help with that, obviously collaboration is a very important part of how we work, so that we're not all working in our little modules where we don't talk to each other, that we need to actually work across teams to make sure that this is implemented. And the 5th principle is that we involve the people who this affects, and that's the communities that we work with, but also the staff who are working in the organisations. So moving away from a top-down approach and actually involving staff in the decisions that are made. So these are the 5 ways of working, also known as the Sustainable Development Principle. So if we go on to the next slide, we at Public Health Wales commissioned a literature review to look at this Sustainable Development Principle and see what the literature could tell us about the best ways to enforce, or not enforce, implement is a better word, implement these 5 ways of working. So there's a picture of the review. The link at the bottom of the page, which Tom will send on to everybody later on, takes you to that review if you want to look at it in more detail. And there's also a really useful infographic there, which puts out very clearly on just 2 pages the information the most important information to come out of this. So these are the findings from that review. And the first one is that these 5 ways of working, long-term, preventative, etc., they're mutually reinforcing, so they help each other. So it doesn't matter where you start. An organisation can look at those and look at what they are most comfortable with, what the best place to start for them. They can introduce these ideas without too much trouble, without too much pushback, and that's a good way in. And the next one is that it's, oh, can we go back one? Thank you. The next one is that it's important that we make explicit that's what we're doing, that these ways of working are visible, that we can see they're happening at all these different levels: people, policies, and practice. And that leads on to the next one, which is that these ways of working work at all the different levels of implementation. So they work on an individual level with members of staff, for example. They work at a team level, at an organisation whole level, and then at the full system level. So again, it's an integrative approach. They support the development of new norms. This has become a catchphrase. I don't know if it's there in the Netherlands, it's certainly here, the new normal. What will the new normal look like after COVID? So we need to come up with a new normal that is sustainable. And that really strongly comes out in this sustainable development principle. And the last one here, embrace the act as a game changer. This is something that can help you really change the way that you work and really change the way that you can have an effect. Now, what I'm suggesting today is that we replace that word act, which refers to the Wellbeing of Future Generations Act, which is only really relevant to Wales, and we replace that with Sustainable Development Goals, SDGs. The SDGs could be a game changer for the way that people work. That's the suggestion. If we can click on again then, please.
Sarah, can we ask one question?
Yes, please.
With a question in the chat from Annelies. What does sustainable development mean to you? Is that about any approach that you can have long-term embed, or is it about climate?
Climate's got to be a big part of it. Climate's an enormous part of it, because without that, none of the rest of it will work. But that's the important thing about Sustainable Development Goals, isn't it? They are so interlinked that it's not just about climate, because you know, we could fix the climate and have gender inequality, and that's not sustainable either. Yeah, this is the point of the circle that you showed at the beginning, with all the different colours representing all the different goals. If you take one of those out, it doesn't work any longer. So they all work together, they all integrative, and that's part of the 5 ways of working, the principle that I just discussed, that they all have to work together. Obviously, each situation will focus more on one than another, depending on, as you said, in the Netherlands, perhaps you're not really focused too much on clean water because that's something you've already cracked. But there are other areas that need your focus. And again, start where you feel comfortable. Start with what, or perhaps that might be start with what is most urgent for you. And that might be climate change, because it is a massive one. But climate change will affect health. So, you know, they all work together.
Okay, thank you.
Okay, lovely, thank you. So, moving on, we in Public Health Wales have what we call is our Health and Sustainability Hub. So the job of the hub is to work with the public bodies in Wales to help them implement our wellbeing goals, which are a version of our SDGs. If we could move on a couple of screens, Petra, please. There we are, that's the Sustainability Hub there. So we've developed a number of tools to help us help others implement the goals. So I'll just give you a quick overview of some of these. If we could go on again. I'm just checking I'm running to time. Yes, good. So initially, we developed these tools to help our public sector organisations work on this sustainability development principle. It's a new way of approaching things. And I'm sure it's the same in the Netherlands. The public sector organisations are traditionally quite conservative, like to do things the way they've done things. So change is difficult. So that's, you know, why we brought these in to help people approach this. And what I'm suggesting today is that these tools, although they were developed for the wellbeing of future generations implementation, are equally applicable to the SDGs. And these are something that perhaps could be used outside of Wales to support implementation of this principle and of the SDGs. So if you look at the image on the screen there, this is taken from Public Health Wales's international strategy. And just as Health in All Policies works on strengthening the social determinants of health, which I'm sure I don't need to tell you about this, I'm sure. So by working on better housing for people, by working on more secure employment for people, you're actually affecting their health. Similarly, by working on the Sustainable Development Goals, you are affecting people's health, because health is really at the centre of all of these. And if you are working to try and persuade people in other areas of governance that to make changes that will affect health, because that's how our health and all policies works, showing support and showing moves towards enabling the Sustainable Development Goals could be a tool, a weapon in your arsenal, as it were, a tool to help you foster this win-win approach. So we could click on again, please. The tools, I can't remember what's next. I'm hoping the slide will tell me.
Can I ask one question in the meantime?
Yes, please.
We got a very good question from Anne. Could you please elaborate on how and when you would involve the communities, the inhabitants? I think that fits in with the part of how to convince other organizations as well.
Yeah, so we have a unit in Public Health Wales, which is the Welsh, what's it stand for? Welsh Health Impact Assessment Unit, Strategy Unit, something like that, support unit. And we help organisations with their health impact assessment. So what we're doing is saying to people, if you want to enact, if you have an idea that you want to carry out, I'm trying to think of an example. It might be a new road, for example. You want to build a new road. You need to go out to the communities that will be affected by that, and you need to ask them how this is going to affect them in the future. And we use it as a health impact assessment, but it could also be a health and equality impact assessment. And so we've got this unit set up to support people to be able to do that, to be able to assess the effect on the community, and do that by asking the community how it's going to affect them before the plans are finalised. So it's part of the planning process, it's part of the development process. So that's one of the things that we can do to bring the community in. Talking, engagement with what we call stakeholders, which is a funny old word, but engaging with the people who will be affected by any policy at whatever level is vital to help things work in a sustainable way. And we recently had a very large, that's the reason I chose road. We've recently had a very large road plan dismissed because of the effect it was going to have, partly on the climate and on our natural resources here. So that's still ongoing. That's still an ongoing argument, but it has been cancelled now because it was going to go through some vital areas of natural, valuable natural resources. So yeah. Okay. So I started looking at some of the tools that we do have produced, and the first one is our individual level suite of tools, which were based on the Be the Change challenge, which is part of the Sustainable Development Goals suite. So if you're interested in that, you can go to one of the links that Tom shared earlier on and investigate their website, because they do have information there on their Be the Change challenge. So we adopted the name Be the Change, and we developed our Sustainable Steps series. So these are designed to encourage behaviour change on an individual level. We started off using them with the staff at Public Health Wales. That's the individual level change, and these are things that they can do at work, but also in their own personal lives. And it just so happens that the health service in Wales is by far the largest employer. So if you want to work with a large number of people and affect small changes across a wide population, the health service is a good place to start, the health service workforce. So we have e-guides. So the one you can see there with the people on the bicycle, that's the front page of one of our e-guides that we can share across the organisation. And inside that are suggestions, small things people can do, small changes they can make that cumulatively will have a large effect. So that one you can see there is our active travel e-guide. We've also got ones on reducing energy use, both at work or at home, supporting diversity, sustainable meetings, how to hold meetings that you know, we do that quite a lot at work, and we've made a number of changes to the way that we organise meetings so that we have less of an effect on climate change or exploitation, all sorts of things. We've also got posters that we've put up around the building, and we're sharing with other public sector organisations, such as how to procure fair trade tea and coffee, for example. Small things that, if everybody does them, can make a big difference. We have action days where we encourage people to focus on one particular thing and do something together to make a change for that, such as, what did we do? Interfaith visits. So we had visits to different faith groups and from different faith groups to learn more about different ways people live their lives. Litter picking was another one that we did. It's a small thing, but it can make a big difference. And last on the list, goals challenge. So we had challenges that we said to people, you know, why not try a week not eating meat, or try for a week having active travel to work instead of bringing your car. These sorts of things. So we have a little logo there at the bottom that shows Byddwch yn newid, be the change. The different elements of the goals are people. We've given them a little waving hand, a little face, and we've developed one that's similar for the UN goals as well. So those are some of our individual level tools. As you click on to the next slide, we'll look at, these are a team level tool that we've developed. So this is called SIFT. Again, it's an acronym, sorry. It stands for Sustainability Improvements for Teams. But we'll just stick with SIFT because it saves a lot of time. These are workshops whereby teams can get together and look at a problem that they're facing or an issue that they're facing, and use that opportunity to step away from business as usual, to step away from their usual work, the usual ways of doing things, and come up with a new way of doing something and then try and implement it. So it's working on this idea that you come up with a problem, you work on a solution, you implement that, you evaluate it, and then you go back to the beginning of the cycle and start again. So it's an iterative process. The workshop itself has 3 sections. There's a preparation section where you introduce some of the ideas that you want to be working on. The workshop itself, which is 2 hours long, and then a follow-up section where you report back on how well the ideas worked. And it's designed to be self-facilitated. So we worked on a package that teams can take away and work on and do this workshop, and they don't need any of us to be there to do it. They can get on and do it themselves, and they're taking charge then for making those changes, for introducing those sustainable ways of thinking into their daily practices. And that's what's really important, is that it gives teams then ownership of the way that things are progressing and the drive for their team to think in a sustainable way and work in a sustainable way. So it introduces these 5 ways of working and asks people to think about their practices and how they can change those to incorporate these more sustainable ways of working. So where are we time-wise? Okay, what's next? I think it's the trouble screen, the one that's been giving us a trouble this morning.
Can I ask one question in the meantime?
Yes, please.
We got a great question from Leendert. He's asking long-term thinking and short-term politics. Isn't that a challenge?
Yes, absolutely, absolutely. And it's always going to be a balance, isn't it? I mean, we are very lucky in Wales that these the sustainable development principle, these well-being goals are in legislation. So this is something now that even politicians are obligated to be thinking about. Yeah, it's always going to be an issue, I think. But I think if politicians are canny, if they're clever, they will realise that these sustainable development goals are something that actually will give them a short-term political boost. You know, in terms of winning support from people who might vote for them, showing support for the goals will bring them rewards. So I think there's another play-off there, there's another trade-off to be done, isn't there? In terms of, yes, this might win you votes from one sector of the population because you've you know, yes, they want to have more jobs in a coal-fired power station, for example. But you know, if you have jobs in a wind farm, if you can be creating jobs in a wind farm, then you've got something that will carry on into the future, whereas the coal-fired power station won't, and you'll lose those votes 5 years down the line. So politicians need to start thinking in a more long-term way as well. But I mean, politics is not my area, I have to say. It's not something I like to get involved with.
To summarize, politicians also have to adopt the SDGs and live according to them. And also, it really helps that it is secured in an act or in policy. So that helps also for the longer term to keep focus on the SDGs.
Yeah. Yeah, thank you. That's a very good summary. So something that came out of the SIFT workshops, which we're going to go on to in a minute when the slide changes, is we developed a pack of cards. This is a tool that is used in the workshop, but can be used outside of the workshop as well. And that's what we're going to be looking at in a minute for the, brilliant, thanks Petra, for the activity. So I don't think the video is going to work for us today, but I'll basically summarize what this man's saying. This is Graham from the International Futures Forum, who helped Public Health Wales develop these cards. So he's got a pack of cards in his hand, and they look like any other pack of cards that you might play poker or snap or, oh, there we are, got a pack in your hand, brilliant. So there's 52 cards, and each of them has a statement on it. It has a phrase that is designed to help you think in a different way about something. They're color-coded to relate to people, policies, and practice. And you can use these cards in all sorts of different ways, and we've got all sorts of ideas for how people can use them, some of which are quite complex. You can play poker with them. You can use them in a tarot. But we're going to, in a minute, we're going to use them in a very simple way just to introduce the idea. Now, we obviously can't give you all a pack of cards today because we're not all in the same room. So what we've done is we've taken the statements that are on the cards and we've put them into a file, which is the file we asked you not to look at, and numbered them 1 to 52. So in a minute, when we do the activity, someone will give you a number and that will be your statement. And that's the best way we could find to replicate the act of pulling a card from a pack. I hope it works. We'll find out in a minute. So the thing about these cards is that they're not questions. There isn't an answer. There's no right answer. There's no right response. They are there to prompt you to think in a different way. And whatever reaction you have to that is your reaction, and that is valid. So don't worry that you're not doing it right or you're not playing the game correctly. It's really to see what you make of it. And you know, it could make you think it can make you think of something completely completely different, or it might just make you perplexed. We're not quite sure how it's going to work for you today, but that's good. That's all part of the process. We want to find out how it's going to work for you today, which is what the activity is about. The reason they're a pack of cards is that that's familiar for everybody. Most people have played card games, so they know how that works. They know that you shuffle them and then you deal them out, or you pick a card like in a trick, or you know, usually you start with one person and then you work around in a particular direction. So they're familiar to people, but what's on the cards hopefully isn't familiar to people, and that's what's different about them. So before we just go on to the activities, there's one more slide I want to show people, if we can click on. Just there's a couple of more tools that I thought you might find useful, and they didn't fit into any of these, so I just wanted to flag them up before we move on. That there's a couple of reports that you might find interesting. If you want to find out more, on the next screen, we'll see in a minute, there's one which is about Wales, which is about the Welsh, here we are, further resources, is about the Welsh experience, and that's called, hang on, got a copy here, wait a second. So there's this one about the Welsh experience, which is called Sustainable Development Goals, oh yeah, in Wales and other regions in Europe. So it's particularly about Wales, but it does look at some of the other European case studies that might be interesting. And the other one, this one is great. It's quite big, quite thick, a lot of it. It's all about sustainable development goals, and it's got international case studies from around the world. So if you're interested in the SDGs, and particularly how they can relate to health and all policies, this is be a really good read. So there are links there. You can download them from the internet and have them as your very own PDF. So the other link that's on this page, just at the bottom of the page, is our Health and Sustainability Hub at Public Health Wales, in case there's anything there that you are interested in. And at the end of the presentation, there's email addresses, so you can get in touch. Right, that's that bit done. So we can start looking at this activity now that we've got. I think I'm on time, more or less. So if we just click on one more time, we're going to put you into rooms. So you'll be randomly assigned to a room. And when you get there, there's a little bit of organisation needs to happen at the beginning, just 5 minutes. Very quickly go around and introduce yourselves to each other, say who you are, where you're from, and just, you know, very, very quickly what it is you do. Don't take too long, because you won't have very much time for the rest of it then. And choose somebody to be your leader or your spokesperson, or however you want to call it. So this leader, this person, will give everybody a number between 1 and 52, and this is where this is the card bit. So when it's your turn, as if you were drawing a card from the pack, look at the statement that corresponds to your number, but wait till it's your turn, because what we're really after is your initial reaction. So if you have too long to think about it, you might overcomplicate things. We're really after the snap reaction that you have when reading your statement. So that's the first bit. That shouldn't, you know, just 5 minutes. And then the second bit is the actual discussion. So this is the actual activity with the card. So one by one, look at your card, look at the statement that's on it. And on the next slide, we've given you some things to relate that card to, and you can choose. You might read it and think, oh, actually, yeah. So in my job, this is what I do. I can't think of what the prop might be, but here we are. You might say, oh yes, actually this relates to my job, because this is something that I do, or this is something that I need to be doing, or that I plan to be doing, or actually I could do this in my job. It hadn't occurred to me before, but actually this is maybe something that, this is maybe a different way that I could work. similarly, you might think, actually, yeah, this really relates to our situation at the moment with the pandemic, or you might be thinking ahead, hopefully you are thinking ahead, to the health inequalities that are being worsened at the moment. Or perhaps you might say, yeah, this would help with sustainability, but how do I persuade people how that affects health as well? What's the dynamic there? So try and find a way that this statement relates to one of those four things, okay? And you might say, oh, well, actually, yeah, this relates to my job because, you know, I've been doing this in my work. And one of the other people in the group might say, well, actually, yeah, I've been doing that as well, but in a completely different area. You might find that there's a connection, and hopefully it's going to start a conversation about your work, about how we're dealing with the pandemic, or we're hoping that everybody will get a chance to read their statement and say something about it. So it's up to the person who's been nominated to be the spokesperson to try and keep that to time. There's 15 minutes available for this discussion, so try and make sure that everybody gets a chance to do this. And then once you've done that, once you've had your 15 minutes and you've been around and we've had a discussion, and you know, hopefully it hasn't strayed onto the weather or what you had for dinner last night, then they've got another section, just 10 minutes at the end, where what we'd like you to do, please, is just to discuss what you've just done. And say, you might say, that was really rubbish, that didn't work for me at all, that was no help, absolutely no help. Or you might say, wow, I really see things in a different way. Or, you know, it'd probably be a bit of both. You might have some ideas about what worked, what didn't work. That's what I'm interested in finding out today. How did this activity work for you? And so we've given you some questions just to sort of try and steer that thinking. You don't actually have to answer them directly. If you've got something else you want to tell me, then that's great. But just to give you some idea of the sorts of things we thought you might want to think about there. And then we'll all come back and we will hopefully have a chance to discuss that across the group. And that's why you've got a spokesperson. So you've got one person from each group who can feed back. And I think someone's going to let the rooms know when each of those three sections is coming to an end.
Yes. Petra is going to denominate you all in the different groups, and we can centrally send messages. So you will get a 5-minute notice from, okay, switch from introduction to discussion, and after 15 minutes from discussion to evaluation. So you have a bit of a guide to help you keep time. Okay, so Petra is going to assign you all in groups. You will get a notification in your screen. Just click on go to room, and you will be placed in one of the two breakout rooms. We'll see you back later in the end. Well, welcome back. I hope you guys enjoyed the activity we had for you in the breakout rooms. As a big part of the activity was to discuss with each other and evaluate what the tool brought for you. So we would like to hear your feedback as well, to learn from this and look how to make the tool even more applicable for the Dutch situation, but also for other situations. Sarah, do you want to take over here?
Yeah, so there were some questions in the room, which, as I said before, you don't necessarily have to answer, but they were just there to maybe give a steer if people weren't quite sure what we were hoping to get from you. So really, I'm just interested to hear what you have to tell us about how they worked for you, and any thoughts that you have. I'm quite open about it. Not necessarily after anything in particular. So please, maybe if we hear from room 1 first.
Yeah. I'm just looking at my screen.
I'm sorry, Wilma. Your connection is making a lot of background noise.
Yeah, I hear it too. I don't know why.
Perhaps one of your colleagues in your group can give us the feedback you collected in the group.
Ik was een van die collega's.
Kijk.
En ik zat met...
Can you switch to English, Annelies?
Oh, sorry, I was one of the colleagues. I'm very, very, very sorry, Sarah. I thought you'd mastered it by now. I was in there with Judith, Wilma, and Anne, and we assigned each other numbers. And we immediately had really interesting discussions. So we talked about mostly the top two topics: the professional life and the COVID-19 situation, and we would address that, but also some personal views. So please, correct me or add something to me, if I'm not, transferring it all correctly. But it was interesting. One of the issues was, for example, start with what matters, and that was one that really struck a chord with everybody. So we liked the content, not all of it. Some of the lines were a bit too far-fetched or a little bit too complex. So we did not the English, but just because it was a bit too abstract, perhaps. But all in all, it did stimulate discussion and a respectful discussion. We discussed how we would use the cards. We thought for us the English wouldn't be a problem, but in other situations it might be, and also why and how we would use it. Anne from our group said, I would like to use it for a brainstorm session, or we're contemplating new names, or if we want to get to know each other, it might be interesting as well. And especially the fact that you have to start with your gut feeling, that you don't look at it beforehand. So that everybody really appreciated that part of it. But Wilma also added that it might be too confronting sometimes, and if you force these things on people who are not really open to being in a workshop, or if it's part of a structure that people are really not happy about, then it might be too in your face, perhaps. I don't know, Wilma, please correct me if I'm interpreting this in the wrong way. So this we would use it, maybe not necessarily in the whole SDG goal type of way, because this is more about a personal view and less so maybe on the long-term company views, but that was not the question, of course. So maybe the context matters on how you use the cards very much. But we enjoyed, we had a good conversation, and I'm pretty sure we got to know each other reasonably well, even in such a short time.
Thank you, Annelies. And I think it's good to hear also that the cards also work outside of the SDGs focus. So you can use them for tackling a lot of different discussions or problems. Or good to know.
That's brilliant, Henry. No, that's fine. That's great. That's really useful. Thank you so much. Maybe we could hear from the other room now as well.
Tine Zwaan, ik zou daar het woord voeren, hadden we afgesproken. Horen jullie mij?
Yes, Tine, would you like to switch to English, please?
Oh, sorry. Yes. Okay. We had a great discussion. Everybody reacted promptly on the prompt, so there were no blanks. So, well, that was nice. We were with 2, 4, 5 people group. Most people reacted out of the job in the first instance. Later on, also discussed each other's prompts and what we found about it or had to add. It was nice, and as the other speaker said, you get to know each other right away in only 15 minutes. That's nice. We had one question. How do you keep this actual, this way of working? Because we had earlier on also this kind of tools, but then after some time it vanishes from working in our work. And now with Corona, we are not, most of us are working from home. So the distance with colleagues and especially also other organizations is getting, the distance is getting bigger. So it gives more problems to reach each other, keep in touch with each other. So it was a problem. Then we found that Corona had, for some people, how do you get it, trouble in health. For other organizations, it gives chances. So I was the only one. I'm from death counseling. And there is a lot more attention to people with deaths because of Corona. Already had a big problem, but now with Corona, it's coming, attention is becoming much bigger, also from the government. So that's something. And then we thought our health and sustainability competitors, and we thought, no, it's the one, how do you say? It's the same as the other. It's in the, it starts with the one and it becomes sustainable and back. Maybe some other one from the group can give a better explanation for that.
Is there someone who likes to add on that? Or otherwise try in Dutch, I will translate.
Het ligt in het verlengde van elkaar.
Yes. in elkaars verlengde, ja, in het Engels.
Yeah.
Yeah,
They're adjacent. They're adjacent to each other.
Oh yeah, thank you. So we enjoyed it.
That's great. Thank you very much. I think I'm not going to come back on that really, because that's what I wanted to do. I'm not saying that's the right thing to do or that's the wrong thing to do, or, you know, I'm just really interested in hearing exactly that, what your experience was, because that really helps us. I mean, there are all sorts of other things you can do with them, these cards, and we've got suggestions for those that we can share. You can actually have a question before you start and have a way of working through it using the cards to try and think around maybe looking at it in a different way, for example. But I don't know if I've shared that link. I will share a link to the video, which does go a bit further in explaining. I'll send it to Tom to share on some of the other things that you can do with the cards. Annalise, I noticed you're asking, who keeps the overview and how do you follow up? It's really, you don't necessarily need to have
an answer.
follow.
I thought it was just a question that we want to give back as a feedback, but
Yeah.
I'm not sure if there are other groups as well. So
I think there were only two, weren't there, Tom? In the 2 rooms, yeah. Yeah. You know, some people keep the pack of cards on their desk, and when they're thinking about an issue and they maybe suddenly realize they're thinking in the same old ways and maybe they need to change the way they think, they pull out a card and see if that helps them think in a different way. So it doesn't always need to have follow-up necessarily. really, you could, in terms of keeping track, you can treat it just as any other discussion in any other meeting. And actually, you know, I mean, today, hopefully we've recorded this, so I can go back through what you said and I can, you know, make sure I've captured it. But you might find that, you know, you nominate a minute taker before you start so that you've got somebody there to keep track of the discussion and keep track of the ideas that come up. Or, you know, if something strikes a chord with you, if something arises and you think, well, that's a new way of looking at it, I haven't looked at that before, you can capture it and write it down, and then you'll, you know, you've got that ready to act on. If you use these as part of the SIFT workshop that I was describing earlier, there is a sort of follow-up procedure that's part of that workshop, with everybody coming back and feeding back on how well they've implemented the ideas that were created. But you can, you know, you can be using them in any way you like, really. We're running out of time, aren't we?
A little bit, yes.
I've run out of time, sorry. Very, very quickly then to finish with, it says if there are any more questions, but obviously we've run out of time. But if you have any questions, submit them in writing and we will certainly get back to you on those. And there is an offer from us also, and do pass this on to people who maybe had to leave earlier, that we would absolutely love to work in a bit more depth with a team or a group on any of these things we've discussed, or anything else, you know, that we can maybe help with in terms of the SDGs and health and all policies. So please just let us know, and we'd be delighted to you know, discuss that with you and see what we can do to help. And I think there's an evaluation form which Tom will be sending around, which will be really important. Link to follow. Sorry about that. And yeah, just get in touch with us with any queries or any comments or anything. And you can, if you want to, you can get, you can order some of the cards. We can arrange for a pack to be sent out. There's a small fee to cover production, but you know, we're not making a profit on them. So if you would like a pack of cards to have on your desk, then please let us know. I think that's all from me, Tom.
Yes, thank you very much. Well, thank you for the great presentation and taking us through the tools you have developed in Wales. And I think a great offer from you to any organization that wants to investigate the SDGs further and the tools you have developed to have an in-house SIFT training. So thank you for that. Well, and to all the others, also thank you for joining. Hopefully you had a nice webinar and you had some new insights to use in your approach or your field of work. Please let us know if you have any other questions. We've added our contact details in this slide as well. You can just email us and we will decide who will answer you, but just email one of us and we will get back to you. So thanks again, Sarah, for enlightening us with your approach, and I hope to see you soon in another webinar, or in real life, of course, if the COVID is gone. I would like to finish with one small remark. Our next webinar from GezondIn will be on November 13th. It's a Friday the 13th, but it will be a good webinar. It's about armoede, schulden en gezondheid. So I think it's very useful for this audience as well. So thank you all, and see you soon.